Thank you for the invitation to come and share. I think that the first two presentations are a really good entry point, reminds us of the need to have some sort of indicators that can help us compare across countries. But then, of course, we're caught in this inherent paradox in which we need those indicators to compare, and at the same time, we know that we might risk settling for the lowest common denominator of basic indicators, which will not convey properly the complexity of processes and consequences, outcomes for child well-being in particular countries and geographical regions, as the question that was recently posed. So what I'm going to do here, and I hope I'll make a good case, for the benefits of using multiple respondents and multiple methods to deal with that, and also to have indicators that are flexible enough to be able to capture some of those qualitative differences in different settings. So I'm going to jump from two different parts of the world, and I hope, okay. We're going to go from Liberia to Laos. I just picked two of the countries where I work. They're very different, they're distant, but they have some similarities. The two studies are completely independent, so these are not two sites for the same study. And what I decided is I put the flags here, so you'll have on the top of each slide the flag of the country, so you get confused what study I'm talking about. You'll know whether I'm talking about Africa or Asia. We'll see if that works. It's the new technique I'm trying, so I'll test you later on that. So they're both low-income countries. Laos is working hard to pass to the middle income. About 2/3 of the population in Liberia are under the poverty line, about 1/3 in Laos. So both low income, but not quite the same situation. About half of the population of both countries are under 20 years of age, very young. And majority, as we just saw, live with both or one of their parents. You see in Laos, 84% in the last Laos Social Indicators Survey live with both parents. The number of orphans is low compared to sub-Saharan African countries. We have about 5% in Laos and 7% in Liberia. But we see, and actually we just have the last DHS data for Liberia being released. Got an email like 2 days ago, and I updated the slide very fast. And it's bad. I mean, the news are bad because there are fewer children living with both parents, more children living with with their mother. Even if it's only a percentage point, but you know, it's not very hopeful. And then now with the current Ebola situation, we'll see what happens. But I'm not going to be gloomy. I'm going to highlight some of the good points as well. So what are the objectives of the Child Protection Knowledge, Attitudes and Practices survey that we did in Liberia? There were mainly two objectives. The first one was to create a baseline on knowledge, attitudes, and practices that were held in the communities where both studies were done in collaboration with Save the Children. So where Save the Children had interventions, and they wanted to look at adults as well as young people. And the second objective was to map the resources that were available to vulnerable families in those communities, and to identify what were the barriers and factors that were enabling the protection of children in those communities and children's willingness and ability to report abuses. This is one of our enumerators marking one of the selected households. The design covered a number of methods. The desk review and the key informant interviews were essential at the beginning, particularly, I'll come back to that later, mostly with community leaders, with donors, with UN and other NGO people working with child protection. We did a number of group discussions at the beginning and throughout the study, not only with adults, but also with young people from 7 years old to 17, separate of course. And then the household survey, which is, I will describe more in depth, which was a population-based household survey. And for some reason, it's cut in the bottom, but anyhow, there were 2 household surveys, one with caregivers and one with adolescents. Now we're going to Asia, Laos. Here, the study was far more exploratory. Before Liberia, and there's actually John Williamson here who had been there before scoping the situation. So we knew already that there were problems with children being placed in institutions where their parents were alive. But in Laos, there was nothing documented. There was a lot of anecdotal information. The NGO staff knew about it, but there was not an acknowledgement of it being a problem. So the study aimed to document what were the good caregiving practices that families were having with their children, and also to identify some of the factors that might lead to child-parent separation, and then document alternative care arrangements for children, both kinship as well as institutional care. And the photo was one of the orphanages we visited. So the design here was purely qualitative. We used the desk review as well. Key informant interviews, again, with community leaders, with policymakers, as well as public officials. Focus group discussions, again, ranging from 7 years to adulthood. Case studies, that's a very exciting piece that we did using photo-elicited interviews with 20 children in orphanages, ethnic boarding schools, and Buddhist monasteries. And then an online survey. The online survey had a small component of quantitative, but is negligible compared to the whole design, and so I'm not going to expand on that, but it basically became a very logistical decision of difficulty of reaching people who were key informants but unable to meet with us within the time frame we had. So we used the technology that was available and basically used a similar protocol and allowed them to give us feedback online. So I'm going to talk about two phases because for Liberia it really applies the two phases. For Laos, as I said, it's mostly qualitative at this point, although we hope it will lead into something more representative and a second phase. The first phase is a sequential design that is exploratory and that includes mostly qualitative data analysis, collection and analysis of results using the techniques that I said, and I put the flag whenever there was a method that was only used in one of the countries. And then for Liberia, using what was learned from that qualitative phase to develop the instruments that would be used then in the quantitative phase, as well as the second part of the qualitative analysis. So the core of the Liberia study particularly is under this idea of triangulation, is to have a concurrent qualitative and quantitative data collection. The quantitative was mostly a population-based household survey, and using a lot of census data. It was the 2008 census. And qualitative is, as I said, we did group discussions with different age groups and key informant interviews. And then bringing that all together, that's the challenge of mixed methods, that then you have a lot of information to make sense of, and sometimes they all go in the same line, and then sometimes it's contradictory. So you know that's the challenge and the exciting piece. You also see that I put this dotted line between the quantitative and qualitative because we had that dialogue ongoing. So whenever the preliminary findings from the household survey was raising flags in one direction, I would take the radio, because cell phone wouldn't work, and try to contact the team that was somewhere lost, somewhere in the middle of Barpulo, and say, can you please check more on differential treatment? It seems like in those communities, that seems to be a problem. And that proved really helpful later on. Because I'm going to focus mostly on the household survey, I still wanted to give you a little glimpse of what working with young children was like, and because I want to make a point on having different respondents and going as young as we can with the right methods. I put a little reference, and I'll be happy to share papers that we've published from this, because they really have something to say, and oftentimes challenges adults' assumptions about what is risky and what is protected. And so I don't know if you see these pictures. One of the pictures we used a methodology that uses photographs, and they have to pick photos that represent risk and protection. And this photograph was, they're culturally safe and representative, let's say, so it was not the same bunch of photos for Liberia and for Laos, but some of them were common. And this is a photo of street children. There were some children sleeping in the street, and in Liberia, every kid got that. There were street children, and they commented on how that was bad. But in Laos, every child thought that the kids had been killed because of a road accident, which was very interesting because when we did community mapping, which was another method we used, the rivers and the roads were big flags in every community. And obviously, if we look at incidents of injuries, that's very much in line with that. This is just a kind of a snapshot, and we can go back later in questions on how, for group discussions, the importance of picking the right characteristics of participants and recruiting properly. And one of the things we did in Liberia is, and actually we learned the lesson and simplified it in Laos for the sake of time and resources, is we used, we identified we had to have rural and urban and metropolitan. It was important separating men and women. And so we got those characteristics. But then we wanted to make sure that we had enough children who were not living with their parents in the group discussions. And that proved really difficult. We created a technique in which our methodology, in which the facilitators did the recruitment door to door. So it really became quite time consuming. And it was very challenging to get the caregivers to agree to have a non-biological child to join the group discussion. As much as we tried to explain that there was no benefit, material benefit of participating, there was always that expectation. And so trying to convince them that they should send a domestic to a group discussion as opposed to sending their own daughter or their own son proved difficult, but we managed to get a number of children who were not biologically related. So, oh my goodness, household survey. Very quickly, 3-stage stratified cluster survey. We differentiated rural, urban, and metropolitan because the caregiving practices and the outcomes are very different in those 3 settings. We used the census, the latest census, the sampling frame, and used the enumeration areas in the first stage. The second stage, we used the modified AP method to select households, and then a quiche table to select caregivers. The response rates between 93–94%, depending on adults or children, and then we, of course, calculated the sampling and the post-stratification rates and used them for analysis. The content of the survey included, first of all, demographic and household information, then, of course, knowledge, attitudes, and practices. Because the core of it was to know how people felt and what they knew and how they behaved, the survey did not have a comprehensive household roster except for the selection of respondents, which is a big difference from what MIX or DHS allows, right? So that's a limitation, but I'm just putting it up there for people who would like to cross some of the information at the child level. It would not be possible. Respondents, again in line with what Florence presented, I mean, most households have at least a biological child in. Many of them have actually one or two family children, as they call them, or other, that's how they call them, right? Like other children. But half of them, of the households that we reached, had children who were not living in the house anymore, mostly had moved in to live with relatives if the respondent was in the rural area or with the biological parent in Monrovia. And mostly because of schooling. And that's something that came up again in Laos. Of the children in the children's survey, most of them lived with both parents or with one of their parents. It is a good representation of what I showed in the second slide. Basically, the distribution of who was living with whom is representative of the country's population, although the orphanhood rates were higher than the average country. So I'll just give you 3 examples of knowledge, attitudes, and practices. So we would read the statements and ask adults whether they were true or not to the best of their knowledge. One was when parents cannot care for their children, the law in Liberia says that they should be sent to orphanages. And you see that the true is the brown. I think the colors don't come very well. But at least 1 out of 3 adults thought that the law required that children be sent to orphanages if parents cannot care for them. Second one, if parents give the child up for adoption out of the country, they might be able to migrate to the US most notably. Actually, I didn't mention that, but both countries have a moratorium on inter-country adoptions. Liberia since 2009 and Laos since 2012, both of them out of lack of proper regulations for developing the UN guidelines on alternative care. And here you see that is 48% that think that it's a good way of migrating actually themselves. And then most children in orphanage homes do not have living parents, which we know from the Ministry of Social Welfare, it's not the case. But 41% of adults think that is the case actually, that children are in orphanages because there's nobody to care for them. An example of attitudes, we asked adults whether they'd be willing to take in a child who's a relative, and you see that the purple is they agree, so they're willing to take a relative, even a non-relative. Quite a lot of openness for different ethnic groups, and even for children with disabilities. Less so for HIV positive, although it's still willing to adopt, and it'd be interesting to see what happens now with Ebola. And then whether they'd be willing to send children to an orphanage home with relatives or non-relatives. And funnily enough, they're not so happy with sending them to orphanages, but they'd be happy to send them to live with relatives for sure, and social fostering is very common, less so with non-relatives. We can compare, I'm going to pass on, well, this is, I just point out this interesting paradox where they think that children who are not living with their parents should only be sent to orphanages if there's no family to care for them. So most of them agree, and it's cut in there. But then they're better cared by families than by orphanages, which I think the way interpreted is probably because kinship care is not always quality care. So we can come back to that later, but I think it resonates with what Ron was saying. For practices, again, how are children cared in their communities? Well, very often sent to live with relatives, again, for some reason, cats, but here's a lot, it happens a lot, or sometimes. So very often to live with relatives, not so much to be registered, meaning being recruited by orphanages. The recruitment we saw in Laos, but not so much for orphanages as for ethnic boarding schools, and it was done by the government, which was something very interesting. We can discuss that later. The problem with the step parents, so there's another flag for collecting that type of information, because the step parents don't always want to take in the children. And then this idea I mentioned earlier of differential treatment, which is something that is, we know it happens, but we didn't know to what extent. And it came up with the focus groups, informed the quantitative component, and back to the focus groups. These are some of the things that the children said of how parents treat children differently. Either they provide used clothes for the ones that are not their own biological children, they would cook with less ingredients, or their food is not as good. They will send them to government schools as opposed to the private schools. They will give them more things to do, more chores, so they don't have time to study or to play. They will sleep on the floor instead of having a mattress. I mean, they went on and on, but I just use it to illustrate the usefulness of combining the quantitative and the qualitative. Okay, in Laos, and I will just pass through this quickly, I just wanted to go back to what Florence said. I mean, of course, parental death is big factors in parent-child separation, and quite obvious. But also, in some regions, there's this cultural practice whereby whenever there's a death or a divorce, in Sayabul, in one of the regions where we worked, the children were sent to live with relatives for some time at least. So if that is that's the social norm, then how do we take care of that? And how do we count for that? How do we measure that? Remarriage, access to education, and then here I mentioned village and district offices recruiting ethnic boarding schools, and they have quotas for each region, how many they can send. I'll pass by, but I'll be happy to give references to reports where you can see the long list of limitations. Of course, depending on what sampling approach we use, for Laos it was non-probability, and for the qualitative in Liberia, as much as we were very comprehensive in knocking doors, it was not probability sampling. The household survey was probability sampling, and that's definitely more telling. For the 12 districts where it was administered, and by the way, the 12 districts are home to 40% of the population in the country, so that gives you a little bit of a reference. And then, of course, things we've learned about how to develop better questionnaires and improve the implementation in terms of training the supervisors and so forth. So my takeaway points quickly. The first one, child protection knowledge, attitudes, and practices studies and surveys are promising, I think, for study of child protection. They've been around in the health field for over 50 years. They haven't been used in child protection as much, but although the literature is not very straightforward in terms of linking attitudes and behaviors. We're complex human beings. It doesn't happen, in a straight line. But it's definitely telling. And if people think that sending a child to an orphanage is going to open certain doors, well, that's something to take into account as we try to prevent that separation. The second is the triple T: triangulate whenever you can, test, and then train, never enough. The use of qualitative, quantitative mixed methods. The qualitative for the development of the questionnaires and the surveys was essential, particularly for the context element. And then multi-voice, bring in as many perspectives, and don't rule out young children just because, as Jim Garbarino used to say, well, you just have to ask the question with the same number of words as the age of the child. So if it's 3, just say, is it red, right? So just simplify, but ask it in a way that the child is able to understand. Indicators, Now here I'm going to go from the indicators, the quantitative element, indicator-based, and the context, the qualitative. For indicators, I mean, I just threw in some that came out of those particular studies that we should be looking at, of course. The remarriage, divorce, so what is the marital history, not only the status, but history and, of course, parental death. Differential treatment and maltreatment, violence. A number of children in Liberia would run away from home because they were, disciplined harshly. Access to education and poverty were the two main reasons in both countries why children were separated from their parents, either to complete their secondary education more often or because they didn't have food on the table. And many of the children we visited in orphanages wouldn't even want to go back home during vacation because they had 2 meals in the orphanage and only 1 at home. So how do we make sense of that too? And then, of course, household composition. And then context. And here is something about cultural differences also in well-being. Taking into account ethical and cultural diversity and norms in each particular setting. And if any of you are into reading Nature, last week I made a point on that, particularly in the ethical, the cross-cultural, in my case was mental health, using ethical, locally ethical standards. And then critical reflection. We found, and that we might wrap up point, we found when we did the group discussions with young children that the local researchers, not just me, I mean, I'm used to being surprised when I go somewhere else. But the local researchers were surprised at what the kids were saying. They would pick as protective things that as adults were risky, and they would pick as risky things that we thought were protective. So it was a good reminder for all of us. We have to be ready to question our assumptions, to question normative thinking, and incorporating different voices helps us do that. And this is gratitude to everybody from funding to who participated and with whom. I mean, we talked in Liberia almost 2,000 people. In Laos, we did interviews. You calculated over 500 people. Couldn't have done that with all these people. And then, if you want to find out more,